What is hip internal and external rotation and what muscles do the rotation? And then how do you test for rotation? So let's dive into all of that in this week's post. So when you think about hip internal and external rotation, you think about what's happening at the hip, not what's happening at the foot. And that's what's can make it so confusing. So for hip external rotation, you are rotating your hip out or open and your foot is going in. So this is external rotation. For internal rotation, you go the other direction. Your hip rotates in and your foot goes out. Okay, so what that looks like is this is external rotation and this is internal rotation. So if you have a great deal of one and almost none of the other, that could present a problem for your hip. Now, as far as muscles go, we had a whole lot of muscles doing external rotation because this motion is a really important one for the body to be super strong. So you're thinking glute max, piriformis, posterior fibers of glute medius. You're thinking all those deep hip rotators like your obturator internus and externus. So you have a whole lot of muscles doing that external rotation of the hip. Now for internal, you can have less muscles. You have your TFL, which is a hip flexor, but then you also have those anterior fibers of the glute medius and glute minimus, which do internal rotation of the hip. So oftentimes I will see people that have weak glute medius anterior fibers and they have a very dominant TFL. So that hip flexor does all the work because those anterior glute medius fibers are weak. So they actually have weak internal rotators when we come to think about what's happening at the hip. So let's dive into testing it and then let's dive into exercises.